more allergenic components in industrial food. So, no answer. We don't know. 8. Is white meat less allergenic than red meat? In France, we divide, and I think it's the same more or less in other countries. We divide meat in white meat and red meat. White meat is chicken, rabbit, veal, lamb, and pork, and red meat is mainly beef and duck. And in the population, often population think that white meat is less allergenic than red meat. But we have also now the answer to this question. It is not the case because, for example, chicken is one of the most important allergenic food for cats. It is the same for dogs, for example, and for dogs, lamb is also a very common allergenic food. So the answer is no, white meat is not less allergenic than red meat. Raw meat is perhaps less allergenic than cooked meat. With the buff diet, a lot of people think that buff is better for a lot of things, and perhaps also for the presence of the absence of allergy and food allergy. You know that the difference between raw meat and a cooked meat is that proteins, there is a transformation of the shape of the protein. So with this transformation, the modification of the shape, different parts of the protein can be catched perhaps more easily by the immune system, and so allergy could be more frequent with this transformation of the shape of the proteins. In cats, we don't know. There is no scientific paper about this question, but in dog, we have an answer. In dog, for example, there is 45% of dogs allergic to raw meat and only 24% allergic to cooked meat and 30% allergic to both. So the answer is really no. Raw meat in dogs is not less allergenic. It is the opposite. It is more allergenic than cooked meat. So perhaps that in cats it is the same. We don't know. We need a proof, but we know that in dogs it is not the case. Raw meat is more allergenic than cooked meat. Question 10. Can food allergies be triggered by a new food? To add the answer to this question, we need to look the pathophysiology of the different steps of allergy. The first step in an allergy is called sensitization. You need sensitization to be allergic. Sensitization is the first contact between the allergens and your immune system. Without this first sensitization, there is no presence of memory cells, memory lymphocytes. The sensitization is is an obligation to have the presence of memory lymphocytes. And after this first presentation of the allergen to the lymphocytes, after the presence of memory lymphocytes, for the second presentation of the same allergen, the immune system could react. And in this case, you will have an inflammation and an allergy. So, if we look now at the question, can food allergy be triggered by new food? You have the solution here. The solution is no, it's not possible. If it is really new, you need a third step of sensitization. Without this step of sensitization, you can't be allergic to a new food. But be careful, what is really a new food? New food is not a new bag and a new factory, because often in the brain and in the mind of owner, new food is just a new factory and a new bag. But if it is chicken in the food one and chicken in the food two, it's not a new food. Same protein, same food. Question 11. Is it a genetic disease? We don't know, but it is highly suspected. Today, there is no predisposed with food allergy in cats, but it seems to be genetic because there is in the same family you can observe different cats with allergy. What does a food allergic animals look like? In cats, there is a lot of presentation in case of allergy. It's not specific of food allergy. You can observe that with a lot of allergies, flea allergies, allergy to mites or pollen. It could be exactly the same. So you will observe pruritus. Mainly, it will be non-seasonal, except if there is a seasonal food. But if it's not the case, pruritus will be all the year. And there is different type of patterns: neck and head pruritus, symmetrical alopecia, eosinophilic granuloma complex, and also miliary dermatitis. We will see a few pictures after that. And there is often an association of patterns in 50% of cases. And there is, as I said at the beginning of this presentation, sometimes an association with digestive signs in 10 to 30%. So, miliary dermatitis look like that. It's mainly crust and alopecia, mainly on the back of the animal. Head and neck pruritus is crust and erosion on the neck and on the pruritus. This case is really a severe one. It is often just a small lesion or one or 2 centimeters. This one is very severe, but it's the same presentation in just a little area, mainly. Third presentation is symmetrical alopecia with an alopecia mainly on the abdomen. And the last one is eosinophilic granuloma complex. You can observe either an ulcer on the lip, like on the picture on the right, but also also sometimes thickening in the mouth or thickening on the abdomen, mainly with erosion and erythema. Few cases with this presentation with a lot of scales everywhere and alopecia and erythema, but it's rare. It is mainly the other one. So we know what is allergy. We know what is the allergenic food, how it can be allergenic, what is the frequency. We know how. An animal with allergy, but how can we know if a cat has a food allergy? So for that you need to have a specific tool of diagnosis. History is not enough. Sometimes you can have a suspicion, but often you have nothing with the history, so it's not enough. Clinical examination is also insufficient because with flea allergy, food allergy, or mite allergy, you will have the same presentation with the same patterns. So patterns is not a good tool for to do a diagnosis. So after clinical examination, sometimes you need diagnostic tests. You will have a lot of laboratory offering you blood tests with serology for IgE, immunoglobulin E, but it is really not a good tool, so don't use it. Even if there is a lot of possibility to do it, it is not a good test, so don't do it. If you do that, you have the same chance to obtain a false result as a good result, so it's not a good test. You have also Western blots. It's another tool, but I don't know if you have it in Romania. It's just at the beginning in France, and it's not used a lot. Skin tests with intradermal allergy test. Don't use it. It is really useful for pollens and mites, but you can use it for food allergy, so don't do that. Histopathology, also it's a bad test, a bad diagnostic test to obtain the diagnosis of food allergy, so don't use it. So the only way to have a diagnosis is to do an elimination and provocation food trial. It's the only way today to have a specific diagnosis of food allergy. It's not easy because it will be a long trial during more or less 2 months and a half. How can we know if a cat has food allergy? You need to use specific food, but you know that there is different type of food for skin disease. You have food to obtain better quality of the food, and you have hypoallergenic food. So to do an hypoallergenic diet and an elimination diet, the only way will be to use an hypoallergenic food. And this time, the more important question is, what is exactly a good hypoallergenic food? Are all the hypoallergenic foods the same for the diagnosis? The answer is no, I tell you. No. When you want an hypoallergenic food, you want a food without all these type of elements. know that these aliments are the main foods linked with food allergy. So no wheat, no soy, no corn, no egg, no beef, no dairy product, no fish, no chicken, nothing of that. Now, if we look at an example, it is this pink bag of hypoallergenic food, and we look the composition. In the composition of this food, you can see there is egg. Egg is one of the most important allergenic food. So it's not a good hypoallergenic food. Another example, this one, again a pink bag. In this pink bag, hypoallergenic diet, you can see there is chicken and there is egg. So it's not a good hypoallergenic food. So no, the hypoallergenic food are not all the same for the diagnosis. For the diagnosis, you have only two possibilities. So what is an efficient hypoallergenic food? Allergenic protein is can be catched by the immune system. The first option to have an efficient hypoallergenic food is to give to the cat a new protein, a naive protein for the immune system. With a naive protein, there is no sensitization to this protein, so the immune system can't react, can catch this naive protein. This type of naive protein, you can obtain this protein with either industrial food, example with venison. It's an example of food you can give to the cat. It's a naive food, a naive protein for the immune system. If you are not a cat of hunter, because if you are a cat of hunter, sometimes perhaps you eat venison. But in France, it's not a lot of cases. And the other solution is to give a homemade cook with horse or rabbit or ostrich or fish, something that the cat never eat. Never, 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 never eat. The second and last solution to do an efficient hypoallergenic diet is to give an hydrolysate of the allergenic protein. So you don't choose a naive protein for the immune system, you take the allergenic protein, but with a chemical process you will obtain not the same protein, but small parts of the protein. And I told you, to be allergenic, you need to be a big protein with a big size. If you have small size, the immune system can catch you. So with the hydrolysation, the allergenic protein is not allergenic at all. To do that, you have no choice. There is only industrial food with this process of hydrolysation. And there is different factory using this system of hydrolysation. But there is different type of hydrolysation. If the immune system is the end, I told you it is easy to take something if the size is big, and smaller the size is, more difficult it is to catch it. So hydrolysation and the capacity of hydrolysation of the process is important. If the size is small, the reaction are rare, but you can have a reaction of the immune system with small size of hydrolysate. But with very small size, so with a severe hydrolysation and high level of hydrolysation, you have very small size,